Hi, can we start? Okay. A very good morning to professors, associate professors, our invited speakers, distinguished guests, ladies and gentlemen. We are going to start our program by the national anthem. Okay, thank you. So welcome once again. It is my pleasure to be your MC for the day. I am Dr. Menaga Ganesan from the Faculty of Medicine, Bioscience and Nursing of MAHSA University. Welcome to MAHSA International Medical Technology Conference 2022. Before we get started, I have a friendly request to keep your audio settings muted at all times, unless speaking or engaging in a conversation to reduce the background noise. Your cooperation is highly appreciated. So, dear participants, to begin our opening ceremony with blessings, I would like to invite Mr. Mahadi to lead the Doa Recitation and a moment of silence.
Al-Fatiha. Bismillahirrahmanirrahim. Ya Allah, Ya Rahim. Praise be to God, the Lord of the world. Peace and blessing upon our Prophet Muhammad sallallahu alaihi wasallam and his companions, and for those who followed his example till the judgment day. Allahumma ya Allah. On this blessed morning, in conjunction with the MAHSA International Medical Technology Conference 2022, we beseech thee and grateful towards you in favor of all the infinite blessing to us, your humble servant, to live in safe and prosperous life. We seek your blessing and flawless progress of this event from the beginning till the end. We seek your guidance to steer clear of events that would detrimental the progress of this event. Ya Latif Ya Rahman, please bless us with your tawfiq and hidayat. Please guide MAHSA University to greatness, peace, glory and prosperity in this world and the hereafter. Make us your righteous servant that follow your commands and neglect the sinful act. Please forgive us for our wrongdoing. Ya Munzilal Barakat, bestow peace to our beloved country, Malaysia. Preserve us from any threat and disaster, neither man-made nor natural disaster. Bestow patience in us in order to face the challenges from you. Please accept our deeds and please reward us accordingly. ربنا عليك توكلنا وإليك أنبنا وإليك المصير ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين.
Okay. Thank you, Mr. Mahadi, for the Doa. May our event today run smoothly and be blessed. On behalf of MAHSA International Medical Technology Conference 2022 Committee, I would like to thank everyone who is watching our conference live through YouTube and Facebook. Distinguished guests, ladies and gentlemen, to begin with, I would like to invite Professor Dr. Rosli bin Nordin Dean of Faculty of Medicine, Bioscience and Nursing of MAHSA University for a welcome speech. Please welcome.
Thank you very much, Dr. Menega. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. And a very good morning to all. Yang berbahagia Profesor Datuk Dr. Ikram Shah, Vice Chancellor, distinguished guests, speakers, presenters and audience. Welcome to the MAHSA International Medical Technology Conference 2022, MyMed 2022, organized by the Faculty of Medicine, Bioscience and Nursing, MAHSA University. We are extremely proud to be able to host this annual international scientific conference that reflects the vision and mission of MAHSA University. That is, the vision is to be the center of excellence in higher education in the region. The mission are to ensure the delivery of high quality learning coupled with hands-on training through qualified, dedicated and experienced educators, to produce competent and highly skilled professionals who can prove their worth by contributing to their countries in smart and innovative ways, to provide state-of-the-art facilities to ensure the desired standards in education, to facilitate and enhance local and international networking for students and staff, and to enhance and provide research and innovation opportunities at all levels. The scope of this conference is to promote research and innovative ideas in diverse areas of medicine, nursing, biosciences. These ideas should align with the needs of the community and society and demand from the industries. That is the fourth industrial revolution and international global strategies, including SDG. So the objective of this conference are mainly to provide a platform for researchers, academic and also practitioners globally to share their research finding in medicine, nursing and biomedical sciences, to integrate knowledge and expand the current practice of medicine, nursing and biomedical sciences, including some possible solution for current problems, and to establish networking and collaboration with other universities and industry experts. MAHSA University is privileged to have a very strong team of dedicated researchers and postgraduate students who are dedicated to pursue academic and research excellence in the medical, biomedical and nursing schools under the Faculty of Medicine. And we welcome all postgraduate students to undertake postgraduate training in the Faculty of Medicine, Bioscience and Nursing at the master's level, as well as PhD by research. We even include our PhD in nursing under the School of Nursing. This online international conference is an annual conference dedicated to respond to the ever-changing landscape of medicine and health in the world, and especially those affecting the health of nations in the Asia-Pacific region. As the theme of the conference, Sustainable Health in the Post-Pandemic Era, suggests, we are still facing the onslaught of COVID-19. We need strong governmental industrial intervention to promote sustainable health. And the Omicron BA.5 is still a force to reckon with, posing a threat to our waning immunity, and possibly also long COVID and long-term effect of vaccine. There is also a continuing concern of boosting our waning immunity in order to survive and lead new normal lives again. Therefore, this conference is an important contribution to address the sustainability of our lives post-pandemic and to share new research development and direction for our nations. I would like to take this opportunity to thank MAHSA University, our chairman, Professor Tan Sri Dato' Dr. Haji Muhammad Anifah, and also senior management, our Vice Chancellor, Professor Dato' Dr. Ikram Shah, Professor Dr. Sri Kumar Chakrabarti, Director of Postgraduate Studies, Research and Innovation, and especially my hardworking organizing committee for their tireless and continuing effort to ensure success of MyMed 2022. To all delegates and speakers, I wish all of you success and superb networking. I sincerely hope and pray that this conference will contribute towards sustainable health in the post-pandemic era. Thank you very much.
Thank you, Prof, for the warm welcome speech. Next, it is my pleasure to invite Professor Dr. Sri Kumar Chakravarti, Director of Postgraduate Studies, Research and Innovation of MAHSA University, for the opening speech.
Ladies and gentlemen, friends, colleagues, and participants, it is my great pleasure to welcome you to the second edition of MeMed. If you all remember, we had MeMed 2021 last year, and it was a grand success. And this year, again, it is a resounding success because I understand that as of now, we've had 150 plus registrants. So that is a great achievement. for a virtual conference that has continued its trend of attracting the best of participants from all over. And the best part about this MeMed conference is that we address not only medicine but bioscience and nursing as well equally. So they have three streams in MeMed. So after the first session, you would all be drawn into different streams. So rather than talking about this conference, medical students out there and doctors and teachers, we all read about pandemics in our medical textbooks, and you know that we have a major pandemic now, COVID, which we're actually slowly easing out from. Now, as much as we read about pandemics from textbooks, textbooks don't give us one important point, which is every pandemic comes with an industrial revolution. We've had IR 1, IR 2, IR 3, and now IR 4.0. Now, if you notice in IR1 and even the previous industrial revolution, we had cholera and then bubonic plague and then Spanish flu, and then IR3 was HIV/AIDS, and now IR 4.0 is associated with COVID. The COVID pandemic is a disease of the information age. So this is something I think we will have to rewrite in the textbooks. The reason is because for those of for those of us in the ministry and in the world, for those of us who are planning an IR 5.0 and a 6.0, we must remember that we can't take another COVID-like pandemic once again. And historically, understanding that every pandemic comes with an industrial revolution, we would be in for a big soup if we have one more industrial revolution and one more pandemic to tackle it with. Now, talking about COVID, we've never had such an accumulation of scientific studies on a single disease in such a short time. Even when HIV came in 1981, 83, there have been many reports, there have been many researchers and a lot of scientific articles. But if you actually go to Google, PubMed, ResearchGate, and WebMed, you would find that in the 9 months of between March and December 2020, there have been more than 200,000 articles on COVID-19 related work. And this, I'm talking about only scientific articles. There's so many other education articles, such as effect of COVID-19 on education or effect of COVID-19 on the society and so on. In fact, if you see most of the questionnaires these days, a lot of research work is being done on COVID, so much so that it is probably being oversaturated. And another point to note is that the results were constantly changing, and sometimes the results were contradictory. The results of one particular research was contradicting to what was done in another research work maybe 3 months later. And the findings and the advice given even in the public media had created a lot of uncertainty. So the public were not sure what was right or what was wrong, and people needed clarity because we were getting a lot of false and misleading information, especially on social media. Right now, there's no control on social media. Thanks to apps like Canva, we can create our own false data and we can actually spread it on social media. I still remember at particular points in COVID, during the COVID time when the number of cases were coming down, suddenly we got a WhatsApp flyer with the minister, with the DG, making a statement that the COVID cases have increased, but that was false again. And all this misleading information came not only on social media, but also on political media reporting as well. So, ladies and gentlemen, during these past 2 years, we had to fit in scientific processes, decision making, and also emergency treatment and mass communication. These don't fit in easily. These could never fit in, but in these 2 years, we did it, which shows that one pandemic is enough for various different changes in the world. And all this is because of research. We were able to research into various aspects of COVID. Now, high quality research takes time. It takes years. I've had research colleagues in Taiwan who say that they've taken 5 to 7 years to even develop a prototype for a vaccine. But within a short time, we were able to do vaccine trials and release 6 to 8 different types of vaccines. Now there are more than 20 different types of vaccines within a span of 1 year. So we have even accelerated the high quality research, which shows that nothing is impossible. But all you need is something to push you, and in this case, COVID was the pushing factor. Well, it didn't stop with that. When the vaccines came, there were people who did not trust the science behind vaccines. They felt that vaccines are not good. Some even questioned the vaccine efficiencies. Some even went on to conspiracy theories. Some said that it is against our faith. Conspiracy theories, like I know people said that when vaccines are injected in one particular first world country, the people said that when vaccines are injected, they're injecting into this chips, trackers, and microbots. Now, this is not the effect of IR 4.0. This is the effect of Hollywood 4.0, because all movies bring out concepts like this. Movies bring out concepts, so even when we are at home in a normal life, we believe that science fiction can be a reality. But we again disproved all this by publishing articles on COVID and proving that what was done scientifically is true. I think I'll tangentially take a little bit off and talk about publishing, since I said about publishing articles on COVID. Now, there are two types of publishers or researchers. One type of researchers who publish to give accurate information and to learn something new. The other type who publish are those who publish to satisfy their KPI and to extend their contracts or to save their jobs and so on. I don't blame the second type as well. However, whatever said and done, this conference today is to give all of you, scientists, doctors, media, public, on the actual information that we have since MeMed 21. And this 1 year has added a lot of information and changed a lot of misconceptions also. And this not only helps doctors, students, biotechnologists, nurses, but so many others who have become communicators. All of us, including religious people, including reporters, ministers, officials in the ministry, they have all become science communicators. Because if you see in the past 1 year, people have been talking online, people have given updates on TV, and all of them are not doctors or biomedical scientists or nurses, but they are science communicators converted from their existing profession. And some more, if you see the web, some people have come up with innovative ways to bring COVID into their everyday lives, or science into their everyday lives, like comics, books, songs, videos, bloggers, and so on. So, with this conference, we want to hear from you. With 150 participants, we want to hear your innovative ideas, your experience, how we can make best use of what research you have done into the next few months, which is going to help not only in COVID, but also in so many other new generation diseases and interventions that we need. So I wish you a very productive discussion over the course of these three streams, today and tomorrow. And I also look forward to have a conversation if any of you who's interested in doing further research or innovation. So before I finish, I would like to congratulate the team led by Associate Professor Dr. Paul Raj, and also all his team members and the Faculty of Medicine, Bioscience, and Nursing, for having generated yet another wonderful, impactful, punch hitting conference again. So let's all sit back, relax, and enjoy. Thank you very much.
Sorry. Thank you, Prof, for the very interesting and insightful opening speech. Thank you. So, ladies and gentlemen, it is my pleasure now to welcome the Vice Chancellor of MAHSA University, Professor Dato Dr. Ikram Shah bin Ismail, to deliver his speech and inaugurate this conference. Please welcome.
Thank you, Dr. Managa. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Distinguished guests, speakers, presenters, and audience, welcome to the MAHSA International Medical Technology Conference 2022, or MIMEC 2022, organized by the Faculty of Medicine, Bioscience and Nursing, MAHSA University. The scope of this conference is to encourage research and innovative ideas in diverse areas from medical, nursing, and biosciences perspective. The ideas should align with the needs of the society and demands from the industry in the wake of the fourth industrial revolution and sustainable development goals and strategies. The objectives of this conference is firstly to provide a platform for researchers, academicians, and practitioners from all over the world to present their research results in medical, nursing, and biosciences perspective. Secondly, is to integrate knowledge and expand the current practice of medical, nursing, and biomedical sciences, including solutions for current problems. And finally, to establish networking and collaboration with other universities and industry experts. MAHSA University is privileged to have a strong team of researchers and postgraduate students who are dedicated to pursue academic and research excellence in the medical, biomedical, and nursing schools under the Faculty of Medicine, Bioscience, and Nursing. This online international conference is an annual conference dedicated to respond to the ever-changing landscape of medicine and health in the world, especially those affecting the health of nations in the Asia-Pacific region. As the theme of the conference, Sustainable Health in the Post-Pandemic Era, suggests we are still battling the threat of COVID-19, despite the efforts by governmental and industrial sectors to promote sustainable health and wellness against this backdrop of the COVID-19 endemicity. We are still reminded to be ever vigilant against the threat as new strains of COVID-19, especially the current Omicron BA.5, poses a new challenge to the immunity from vaccinations, including booster vaccines. At the same time, we are also witnessing rising incidence of cases of the long COVID that will be a continuing threat to the health and longevity of the nation. There are also concerns about the long-term side effects of the vaccines that must be researched and shared across all scientific platforms so that we can plan and prepare for possible vaccine-related medical conditions in the world. Apart from COVID-19, we are now confronted with new challenges: monkeypox, influenza, hand-foot-mouth disease, and dengue fever that may signal possible impact of the pandemic on our immune system. Therefore, there's also a mounting concern of boosting our waning immunity in order to survive and lead normal and new normal lives again. Thus, this conference is an important step to address the sustainability of our lives post-pandemic and to research and share new developments and directions for our nation. I take this opportunity to thank MAHSA University, our chairman and senior management, and especially the hardworking organizing committee for their tireless efforts to ensure success of MIMEC 22 during this challenging time. To all delegates and speakers, I wish all of you success and great networking so that we can truly share all our effort and research findings to ensure sustainability of health in the post-pandemic era. Thank you.
Thank you very much, Prof. Dato Ikram, for a meaningful speech and officiating MAHSA International Medical Technology Conference 2022. We are going to move on to our next segment. Before we begin, I have a friendly note to all our viewers online. Should there be any questions to our presenters today, please write it down in the comment box. You may send in questions at any time during the presentation. We will collect these questions and address them during the Q&A session at the end of the presentation. With that, it is my honor to welcome our first keynote speaker, Professor Dr. Jamal Hisham Hashim. He is currently an honorary professor at University Selangor and a former research fellow at the United Nations University, and Malaysia's first Professor of Environmental Health at University Kebangsaan Malaysia. Please welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Madam MC, and thank you for the invitation to participate in your conference this year. I think this is my second time. Last year I was invited to the MAHSA conference, and it's an honor to participate as your plenary speaker. So my talk this morning will be on climate change in the post-pandemic era. Can the Secretariat please share my slide? Do you have my slide?
Prof, can you please upload your slides once more? Yeah,
okay.
we're sorry.
Okay. A minute.
Yeah, thank you.
Yeah. Okay. How do I make it bigger now? Yeah. Okay. Can you see it now? Can you see it now? Yeah. Right. Okay.
Yes, Prof, we can
Yeah.
see, no
Okay. Sorry.
problem. It's
Okay.
clear, yeah, thank you.
The topic of my talk today will be on climate change in the post-pandemic era. Yeah. Basically, what I'll be talking about is the global climate change scenario to give an overview of the situation globally, and then I will zoom in into Malaysia's climate change scenario, the change in climate that we have in Malaysia, and what are the consequences that may come from that. And specifically, I will be talking about the health impact of extreme weather event. So one of the most obvious outcome of climate change will be our extreme weather event. And finally, I will be touching on the climate change scenario in our post-pandemic era. Yeah, so these, I think, going forward are two of our biggest challenge. Even though the pandemic may come and go, but I think climate change will stay with us for some time. Yeah? So we need to look at both event or both situation in the proper perspective. And the most recent event relating to climate change would be the COP26 that was held in Glasgow in November of last year. Basically to take stock of the situation globally and to assess the commitment that we have made in the Paris Agreement during COP21 in 2015, which was to limit the temperature rise to below 2 degrees Celsius, but preferably to limit it at 1.5, because when we reach 2 degrees Celsius, the consequences would be quite dire and alarming. Yeah. So, but unfortunately, I think most observers are saying that even with the commitment that was made during COP26, we are still probably looking at 2.4 degrees Celsius warming by 2030. Yeah, so that's not very far away. Yeah, we are in the 2022 now. So they have made some very serious commitment during COP26, which was to face down unabated coal power. As you may well know, coal combustion from our fossil fuel generate huge amount of carbon dioxide, and this is one of the major contributor. Coal power generation, coal power electricity generation, energy use is one of the main contributor to carbon dioxide. And one thing we are starting to see now is the commitment from the developed country in terms of allocating funding, because most of the less developed country has problem to mitigate climate change. So there has been allocated fund of 413 million for mainly the least developed country, 46 of them. Okay, so this is the main contributor to our greenhouse gas, primarily carbon dioxide. You can see that 73.2% come from our energy use, including just now we have coal power. Yeah, mainly in industry use, 24.2%. Then we have energy use in building for heating and cooling, yeah, and also transport. So if we are to limit the emission of greenhouse gases, certainly we have to tackle these three main contributor, yeah, and to move towards a more efficient energy use in all sector. Agriculture is the second biggest contributor. Um, you probably heard about livestock, yeah, which generate methane, which is a more powerful greenhouse gas than carbon dioxide actually. So there's call to limit use of red meat and things like that to minimize the impact from agriculture. But the main contributor still remain the energy sector, which we have to seriously look into it. Well, I mean, COVID-19 actually teach us a lot, yeah, in terms of our energy use. We have actually minimized a lot of energy use through transportation uh, and working from home and things like that, which make us realize that it's not really impossible to do it. Yeah. So this is actually an eye opener. Then maybe the COVID-19 is an eye opener for us in terms of combating climate change. Now, how serious is this temperature rise and global warming? Of course, many argue that there is a natural component. Yes, there is a natural component, yeah, from solar activity and also volcanic activity, but it is minuscule compared to the anthropogenic cause, which is man-made. You can see the black and light brown, yeah, graph, yeah, shooting upward. That is contributed by man themselves. Only the bottom one is natural or and no natural causes. Yeah. What about Malaysia? Yeah, in Malaysia, there is a marked increase of daily maximum temperature. Maybe we don't see it in the uh, in the highest daily maximum temperature. Maybe we don't see it in the lowest low daily minimum, but certainly in the highest maximum daily temperature, yeah, we can see a gradual increase since temperature record was recorded, yeah, since 1951, and it is especially um, alarming for Peninsular Malaysia, as you can see the blue line. Yeah? So there is a gradual increase in temperature in Malaysia. Okay. Oops, sorry. Okay. Now, even though the increase in temperature may be at 1 degrees or 1.5 degrees Celsius, which seems to be quite small, yeah, but the consequences of this is actually quite alarming. And the most obvious consequence of global warming and temperature rise is the extreme weather event. Okay? We get extreme weather in terms of thunderstorm, hurricane, typhoon, flooding, and the opposite would be a drought, severe drought, affecting not just water supply but also agriculture. And this gives us a snapshot of the mortality resulting from extreme weather event. Average annual fatality per 100,000 inhabitants. Myanmar, Dominican Republic, Honduras, Puerto Rico, Nicaragua, Haiti, and so on. And you can see that most of these countries are the lesser developed one, lesser developed one. So the impact can be rather severe. Yeah? For example, Super Typhoon Haiyan, which hit Philippines in 2013. Yeah. Oops, I got cut off. Claim more than 6,000 lives, 6,352 lives with over 1,700 missing. Yeah? So the impact can be very severe, especially when it happened in the lesser developed countries. Yeah? And among the extreme weather event occurring globally, floods seems to be the most frequent one. And I think Malaysia, we are also very familiar with flooding event. Yeah? We had a very severe one in 2014, mainly in Kelantan, but also all over the country. And the most recent one was in December last year. Yeah. So if we look at the data for Malaysia from this emergency event database, up to 2022, for Malaysia, the number of floods event has also increased quite significantly. Yeah? And this is an indication of the impact of climate change on our weather pattern. Yeah. We talked just now about a fatality from extreme weather event in terms of life loss, but the other consequence would be the economic loss. Economic loss in terms of property damages, private and public property damages. Yeah, and this map shows the seriousness of area that would be most impacted economically. And you can see that Malaysia, if you strain your eye a bit, you can see Malaysia there is in the red zone. Yeah, so the economic consequences can even be quite significant. Yeah? They look at 48 countries, which represent 90% of the world economy. So by 2050, the world may lose about 10% of the global economy, if the situation continue as it is. Okay. We did a survey or study among 20 environmental and health practitioners to look at the top most pressing environmental health issue in Malaysia through a focus group discussion. And we asked them to rate the issue in terms of its magnitude and severity. How big the problem is and how intense or severe. So these are the top issues that were rated from 1 to 10, and climate change, adaptation strategies and neglected health issue came up as the fifth most important issue in Malaysia. Yeah. Well, we are mostly in agreement that climate change is probably here to stay. There's nothing much we can do except to minimize it. but we cannot eliminate climate change. So the next most important strategy is how to adapt to this change in climate and the potential occurrence of extreme weather event. So that is what we need to focus. I think Malaysia, we have not really go into that. Yeah, we talk about climate change, but we have not really strategize in terms of adaptation to this changing climate. And we can see our unpreparedness when big floods suddenly hit us, on a large scale or even on a minor scale. The most recent one was Bali. You can see the unpreparedness of the community as well as even the authority. Yeah. Of course, as a team player, as a part of the world community, Malaysia has made its commitment to mitigate climate change or to help reduce the contributor to climate change, mainly the greenhouse gases, especially carbon dioxide. So we have made our what we call national determined contribution, and our commitment is quite serious, or I mean quite significant, where we have committed or we have pledged to reduce 45% of our greenhouse gas emission unconditionally. Previously, we had a conditional commitment in the sense that if we get funding from the more developed countries, we will commit ourselves. But now we are saying that whatever the case is, whether the economy is good or bad, we will make 45% unconditional commitment to reduce intensity by 45% relative to our emission in 2005. So that's quite a significant contribution, and it covers all the 7 greenhouse gases as shown. Of course, the main one is carbon dioxide and methane, but also the others, what we call the F gases. Yeah. Now, if we look at our greenhouse gas emission, it doesn't sway much from the global scenario that we have seen earlier. From 2005 to 2014, the main contributor is still the energy sector. Yeah. In fact, it has increased between 2005 to 2014 from 70% contribution to 80% contribution in 2014. Yeah. This is quite normal for a fast developing country. Yeah. So this is our challenge, and at the same time we are trying to develop, but we have to also commit to reduction in greenhouse gas. Okay. Of course, the other contributor would be the waste sector and also the industrial process and product use, IPPU. Yeah. And in terms of the contributor, of course, carbon dioxide is the most prominent contributor. But being an agriculture nation, you can see that methane is also a major contributor, and it is a more potent greenhouse gas compared to carbon dioxide. Okay. This is the greenhouse gas emission for Malaysia from 2005 to projected to 2030. Okay. And according to our various trajectory, one is the business as usual, BAU plan. Plan is existing policy plus the plan initiative. But what we want is the ambitious. If we want to cut back greenhouse gas by 45%, certainly we have to be very ambitious. But you can see that the reduction is not that great. And the major contributor, the strong yellow, bright yellow, or rather light brown, is still the energy sector, followed by the IPPU, industrial process and product use, and also waste. So at the same time, we have to reduce our energy use, cut back waste, and also make our the industrial process more efficient in terms of energy use. Yeah. And if you look at the planned trajectory and the ambitious trajectory up to 2030 for energy use, since energy is the main contributor of carbon dioxide or greenhouse gas, we can see that transport is the main contributor in green, followed by the industry. And I think that's why I'm saying that COVID-19 is an eye-opener for us to tell us that there are ways where we can change the way we do things, especially in traveling, transportation, where we are very much committed to our personal car, personal transport. And now we have learned that we can do it differently. We can work from home, we can work remotely, and that's what we are doing right now, is actually having a conference also remotely in our own little space at home and in the office. So not everything is possible remotely, but certainly a lot of things. I mean, I used to work with the United Nations, and I travel overseas or once or twice each month. And now I really realize that most of it is really unnecessary, where we can do it through web conferencing and things like that. Sometimes you travel halfway around the world to give a presentation with 40 minutes of it, or half an hour. So that is considered quite unnecessary and a bit overdone. So in terms of the consequences in terms of temperature and rainfall changes for Malaysia, we can see the observed changes, those projected for 2030 and 2050. So you can see here for rainfall, especially for Peninsular Malaysia, there is a potential increase of 7 to 11% by 2050. So if we are seeing increased event of heavy rainfall, thunderstorm, and flooding, that would not be surprising if we take climate change into account. And the other issue that we have probably not discussed much, or try to address, is the sea level rise. Because as the ocean warm, the water expand, and that will cause sea level rise. And at the same time, the melting polar ice would also result in increased sea level. And you can see here Sabah, for example, they projected up to 2050. There might be an increase up to 0.6 to meter in terms of sea level rise. So that would probably inundate much of the coastal area, but it would also cause salt water intrusion into our groundwater, so that will make our groundwater less usable, and also may also affect our agricultural productivity. But the most worrying impact on climate change would obviously be the impact on human health. So we have the rising temperature due to increased carbon dioxide level, rising sea level rise, and more extreme weather event resulting in the second level of impacts on the environment, like severe weather, air pollution, extreme heat wave, right? What's happening in UK right now? They have recorded uh, in excess of 40 degrees Celsius. I think in Malaysia we have experienced one in Chuping Perlis, where the temperature was above 40. So even we are not very familiar with that kind of temperature, but they had that happening in the UK. So you can see the impact of this extreme temperature, extreme heat event. This would then lead to air pollution, changes in vector ecology, water impact, extreme heat, and so on. But the most worrying would be the outer circle of health impact. We're talking about increase in asthma prevalence, increase in vector-borne diseases, respiratory consequences, waterborne diseases, malnutrition, forced migration, heat-related illness, and injuries and fatality, and mental health impact from extreme weather event like the flood and so on. So there's a lot of work to be done in terms of looking at the health impact and how to minimize, mitigate, and how to adapt to this changing health scenario. I think the most recent event in terms of severe weather or severe extreme weather event would be our recent December 2021 flood, especially in the Klang Valley, where we had what we call a tropical depression from the Pacific Ocean, tropical depression 29W, which had landfall somewhere near Kuantan, and it moved across the peninsular Malaysia, resulting in heavy rainfall over 3 days. And it affected about 8 states across Malaysia, but the Klang Valley was severely hit. Overall, there was a displacement of more than 125,000 residents, and unfortunately, we lost 54 lives, and 2 missing. So they're probably dead as well. And one of the most worst hit area was Taman Sri. I missed something. Taman Sri Muda in Shah Alam, which in that area itself it recorded 14 deaths. How severe was this flooding? You can gauge that by looking at how the smart tunnel had to be operated over 22. Oh, there's missing again. Sorry, 22 hours. 22 hours, and it had to divert 5 million meter cube of flood water during that period. Usually, the smart tunnel only worked for a few hours, but in that event, it had to be operated over 22 hours. And the economic loss from this flood had been estimated to be between 6.5 to 20 billion, depending on the source. So that is quite a significant economic loss from just one flooding incident. Okay. So, in my team look at this flood event and try to see where actually we went wrong. I was once expert member of NATMA to look at disaster management in Malaysia. And one of the things that had pointed out is that, of course, climate change and extreme weather event in most cases are unavoidable. But there is one thing we can do is to avoid the loss of life. Avoid the loss of life. So we should focus on that. And it is quite unfortunate that in the last event, we lost 54 or maybe 56 life. Yeah? It's not the first time that we are confronted with flooding. So there's a lot more we need to do in terms of to mitigate the damage done, especially human life. So we have to look at the bigger picture of risk management, risk and preparedness and management plan, yeah, which is what we call the different stages of disaster risk reduction. So it start with mitigation. Uh, that means something to be done before being prepared. Yeah, in terms of updating our public infrastructure and maintaining it. They talk about, for example, Sri Muda, the canal was not properly maintained. So that was, I think, something inexcusable. Yeah. In urban area, surface water flow is an issue. So we need to seriously, because urban area are very prone to flash floods. Yeah, risk assessment. This is what we need to do to look at hazard assessment and vulnerability assessment. Who are the vulnerable population, where they are, especially the elderly people. I think we lost a lot of life among the elderly because they have less capability to escape such an event. Uh, and then we have the preparedness, yeah, preparedness in terms of when it happened. Yeah, we have to have a proper emergency preparedness plan in place. Early warning system, of course there was warning about flooding, but maybe it did not get to the public on time, yeah, or the public did not take the warning seriously. Yeah. And this is probably part of the public awareness program. If you go to countries like Japan, and the awareness level is very, very high. Yeah. Of course, they face more natural hazard than us, and not just flooding, but also earthquake, volcano activity, and so on. Yeah. But certainly we can learn from them. I think even Indonesia has even a better preparedness because of uh, the um, the natural hazard and disaster that they face. Yeah? Uh, if an event happen, yeah, even though how prepared we are, then we need to look at how we respond. Yeah, public rescue. Yeah, it was sad to learn that in Sri Muda they had to search for their own boats. Yeah, yeah, they have to call faraway places to find boats to save the families. So that, I think, is a sad matter. Yeah. Administrative response. We have our national emergency response plan, but maybe we need to relook at it again. Yeah, there was some criticism on this from NGO and the public. Temporary evacuation center, I think we are quite good at that. We have ways to set up evacuation center in a short period of time. So that's not so much an issue. Recovery, that's important. Recently, my friend told me that he had to help a friend in Ululangat, which was hit by the flood. So we are talking about what, 7 months after the flooding, people are still struggling. Yeah? So recovery in terms of, when we talk about recovery, physical reconstruction, they talk about building back better, building something better than what was before. Yeah? And also what we may have neglected a bit is the victim rehabilitation and support system. Yeah, to make sure that they survive the event, and they are more prepared in the future. So what we are talking is about this climate risk adaptive capacity. Yeah. So you can have a country like Japan, Korea, which have very high adaptive capacity. You can see there, US, Europe, they are uh, very much better prepared than countries like you can see there. That would be India, South Africa, uh, even Indonesia, and Malaysia is somewhere in between. So we have to improve on this. We have to upgrade our ability to adapt to the changing climate and also to this event of disaster. So moving into the future, in terms of um, reducing our greenhouse gas production or emission, yeah, we have to move. One of the most important sector is the energy sector, and in the energy sector, we're talking about mainly transportation. Yeah? And as you know, Malaysian are very attached to our personal transport. Yeah? Even though we have the LRT and MRT, I think we need to improve on to further upgrade our public transportation. But at the same time, maybe to move away from the fossil fuel to more electric vehicle. Yeah. So we have recently adopted this low carbon mobility blueprint. 21 to 2021 to 2030. Yeah. So electrification of the personal vehicle and also increase of public transportation use. Okay. Uh, we did one study. This was from one of my PhD student. Yeah. We looked at the uh, the MRT 1 and MRT 2. Yeah. The potential of the MRT, mass rapid transit system, in terms of not just carbon saving, but also in terms of the health co-benefit. What would be the health co-benefit that may accrue from this model shift from from private to public transportation? Yeah. So what we found out was the shift from private to public transportation would of course result in the reduction in carbon dioxide emission, but at the same time it will also help to reduce air pollutant in terms, especially in terms of particulate emission PM 2.5, which is one of the most damaging air pollutant. So you can see there's a total reduction of over 200 tons in carbon dioxide and uh, over 67,000 gram per day in terms of particulate 2.5 reduction. So we are talking about climate change mitigation since we are able to reduce carbon dioxide emission. But at the same time, we also help to reduce air pollution when we shift from private to public transportation. Yeah. Okay. Um, yeah. Then, so the main outcome of public transportation would be reduction in air pollution. And when you, because you take cars off the road, and when you take cars off the road, you will also help reduce traffic injuries, road accident. Yeah? And at the same time, people are more actively involved. Yeah? So they walk or they cycle to and from the MRT station. So there would be increase in physical activity. Yeah? So we look at the outcome of these three consequences in terms of avoidance of death and avoidance of DALYs, disability adjusted life years. Yeah. And surprisingly, the most benefit that comes from this shift to public transportation is actually in the physical activity, which is able to um, oh sorry, this one is kind of shift. It's a move sometime when we show this on the presentation screen. It move. But the greatest benefit would come from the physical activity. Yeah. An avoidance of 90 deaths and 3,000 over DALYs. Yeah? The bottom one is total. Yeah? And then this is more than uh, wait a minute, it has moved a bit. This is more than traffic injury, avoidance of 161 deaths, and also air pollution. Okay? So the biggest benefit, in summary, the biggest benefit would be from the improvement in physical activity. Second would be in traffic injury, and the least would be actually be in air pollution. Yeah. So this is killing several birds with one stone. Yeah. Moving from private to public transport would not only help us to mitigate climate change, but it also improve in our health co-benefit in terms of healthier public, in terms of improved physical activity, reduction in traffic injury, and also air pollution. Okay. Sorry for that confusion just now. Okay. Uh, so how do we adapt to this changing climate in the face of something like the COVID-19 and the pandemic happening at the same time? Yeah. Um, we need to upgrade our climate modeling capacity. That means to give more lag time, yeah, between the prediction and the actual event to increase our preparedness. Yeah. Monitoring and forecasting of extreme weather event to more accurately. This has become quite a challenge because with the advent of climate change, it has complicated forecasting of extreme event to a certain extent. Yeah. Agriculture would be one of the uh, impacted sector. So not only we have to adapt, but the way we conduct or the way we do agriculture has also to be changed. Yeah. We need to prepare our public uh, better for respond to extreme weather event such as heat wave, drought, and flooding. Yeah, to what we call increase their preparedness and resilience. Yeah. At the same time, to improve national disaster response mechanism and some further improvement to our management plan. Okay, so yeah, that is my presentation today. I think we have some time left for question and answer. So I'd be glad to uh, address any question that you may have pertaining to my presentation this morning. So thank you again for inviting me this morning to share my thoughts on climate change and also on extreme weather event and the consequences from these two events. Thank you very much.
Thank you, Prof, for the very insightful talk. I think now we all have a better understanding on the current issues regarding climate change and the current and future plans on the disaster risk management. Thank you once again. So may I now request Prof. Rosli to present Prof. Dr. Jamal Hisham Hashim with a certificate as a token of appreciation. Thank you,
Thank you.
Prof. Rosli, and thank you, Prof. Jamal, once again
Good.
for the very interesting talk.
Thank you, Prof. Jamal, for a very insightful talk, and thank you for supporting our conference. And we look forward again
Yeah,
to
you're
you in other conferences. And good luck to your, your very insightful work on climate change and extreme weather. Now, I was worried that yesterday I saw there's a big fire in London. I think yesterday or today, big fire, and they're
Yeah.
attributing it to the temperature. It's London, 40 degrees. So this is,
Yes.
I think, one example of what you are saying in your slides. Yeah. So thank you very much, and look forward to see you again, Prof. Jamal.
Okay, thank you.
Thank you. Thank you once again, Prof. Rosli and Prof. Jamal. Next, it is my pleasure to welcome our next speaker, Associate Professor Dr. Nora Ahmad from the Faculty of Health Studies, Department of Nursing, Brandon University, Manitoba, Canada. She has over 28 years of nursing experience and extensive experience teaching abroad. Welcome, Prof. Please unmute, Prof. Unmute.
Okay, thank you so much. Okay. Firstly, I would say Assalamualaikum and Salam Sejahtera, and thank you so much for inviting me. And it's my honor to be here in the conference. Today, okay, how should I share this one? Okay, thank you. Okay, today I will give some insight about our research on professional quality of life, stress and trauma of nursing students before and also during coronavirus pandemic. Okay, we carried out this research in 2020 and 2021. My colleague and I tried to figure out to see, okay, what happened here. As we know that many nurses having a lot of psychological impact, mental health during COVID-19 pandemic. When we look at the research, most of them looking at nurses, and then we know that nurses facing like traumatic event because they have to face a lot of challenges. They have to see, to deal with the death, and also there's a lot of uncertainty, the fear of unknown, and so many things. And many nurses here, they plan to leave the profession, and also for the senior staff, they would like to retire early. So that's what happened. And if you look at the literature, there's so many, as Frosty was say that I don't know, maybe 1,000 research on the impact of COVID-19 on nurses. So when we look at the literature, then we see that the area that we need to look is the area on the student nursing student, because not many people look at or carry out research on nursing student. Most researchers focus on nurses itself. So that's why we say that, okay, let's do this, let's look at what happened to the nursing student during COVID-19. So as we know, the impact is a lot, I would say. We can see the death, the burnout of nurses. They are stressed. They fear of unknown. They don't know what. The information is lacking and a lot of uncertainty. So they also facing like lack of resources. There's not enough PPE, gown, mask. You can say, you can mention, there's so many things. So this is the impact on the nurses, and you can see that is I would say all over the world that we have nursing shortage. um, so this is the general impact on nurses, I would say. So what happened during COVID-19? Okay, students in the university, what happened behind that is that university closed the door, but the program is still running. Okay, so we still run the program even though the student cannot come to the faculty. They need to stay at home. Home here, it doesn't mean that their own home, because if you look at international students, some of them, they stay in their, I mean, rented apartment or rented hall in the university, and some of them, of course, they manage to go back to their own place. Okay, so what happened during COVID-19, that the program is still running. Okay, so of course there's no in-person. Most theory we conduct online, but we still have lab. We schedule small group, so that small group come and practice and then go, and then we do the cleaning and come back another batch. So this is how we manage the program delivery during COVID-19. We also use a lot of simulation when we inquire with the nursing board here. To replace the clinical placement, we can have 30% to 50% simulation to replace the clinical placement hours. So this is a big help, because some of the challenges is that we have difficulty where to put our student. Okay, because most hospital, they not really want our student to be there, especially when the COVID is really like, I would say there's no ward without COVID-19. We still continue our clinical placement. We send our student to the hospital, long-term care, and also community. In here, what we do is that the student in third year and fourth year are allowed to deliver the care for the COVID-19 patient, but not year two, because we believe that they are not ready. Their theory is still not at the level that they can cope with the sign and symptom of COVID-19 patient. So this is what happened. Even though the university is closed, but we're still running our program behind that. So for this study, we aim to assess the level of stress, burnout, primary and secondary trauma, and also self-efficacy before and during the coronavirus pandemic. So our sample, nursing student from nursing department, and also psychiatric nursing student. So in here we have two programs. One is nursing, general nursing, and also psychiatric nursing. Okay. So we use the professional quality of life scale, where we assess the both negative and positive aspect on job, how the job influence them, whether they satisfied or not, whether they really want to go to work or they don't want to go to the work. Okay. And also we have also the scale for the burnout, whether they feel exhausted, frustrated, anger, and also depression related to the work. Okay. And we also assess secondary trauma stress, which is feeling fear in relation to work-related primary and secondary trauma. The second scale that we use is the perceived stress scale. We try to measure and compare the stress level before and also after the COVID-19. And then we also have another skill which is called the life event checklist, which is self-reported about the event happened to them and whether they witnessed the happen and what they learned. Okay, this can be during their clinical experience in the hospital or any long-term care or community. And the other one, we use the core self-evaluation scale. We try to assess and measure their self-esteem, self-efficacy, locus of control, and also their emotional stability, whether they are in a state that under control or not, okay? Or whether they are in a state of anxiety because they're having so much stress. Okay. So from this study, the findings show that compassion satisfaction is very low. They don't feel satisfied, not with the clinical placement, and also with the, I would say, the theory itself in the university, because they have to do everything online with less support. They cannot mix with their friend unless they want to connect through online. They feel burned out because they feel frustrated, anger, and they're not sure whether they can graduate on time, which is very important for the student. They always say that we want to graduate on time, whether there's a COVID outside there or not. Okay, so this is very, very important aspect to them because they pay a lot of money for the tuition fees. So they want to graduate on time, and we should deliver what we promised to the student, even though in the situation whether we like it or not. We also see that increase in the secondary trauma stress. It's just unbelievable experience for the student when they go and deal with the COVID patient, where they can see so many patient die at one time, and this is not something even event that they really want to see. If in the normal situation, maybe they can see one or two per day, but in this situation, they might see 10 or 20 at one time. Because of that, their stress level is very high. Their life event also imbalance, I would say, and they have more emotional instability. So the finding quite similar with what nurses facing outside there, but of course for the student they have two perspective, which is their clinical and also their study in the university. During pandemic, what happened to the student? The student experienced more traumatic event. They witnessed patient death, or maybe some of them also experienced several family members die within a short time of period. They also have family imbalance, family dynamic. Sometimes because of the COVID, they have to be alone, need to isolate. They cannot be with their partner or their husband or their children. So it's very imbalance between the work life and the work-life balance. So as you know, if you work in the hospital, if you dealing with the COVID-19 patient, so you don't want to go back to your family, bring the virus to your family. So this is what they call that imbalanced work-life balance. During pandemic, the student also experienced, they see a lot of domestic violent cases in the hospital, and some of the student also we found that they use a lot of substance abuse. Maybe due to the stress, one of the way how to go out is that by taking substance abuse, which is not the right thing to do. Some of the students also experience racism, which I would say some people would like some different group to give the care, and they sometimes can say that I don't want this nurse, I want the other nurse, based on their color or their groups. Okay, it's happened everywhere this day. Another thing that happened to the student is that they feel so isolated. I remember one of my students say they don't have anybody to talk, they have nobody to connect, and if they email the faculty member, also sometimes it will take time to come back to them when they really need help. Okay, so during pandemic, we know that the student stress level is increased. They don't feel satisfied with their life and work balance, and also their well-being. We also identify that the student who have higher degree of self-esteem and self-efficacy have a higher focus of control and greater emotional stability. When they have high efficacy and self-esteem, they always have their locus control and also emotional stability. So that was the research that we carried out, and we found that students experience a lot of traumatic event during pandemic compared to before the pandemic. So what we need to do, this is about research. I know that people always talk about research, share your research, talk about your research, carry out research. So the most important about research is about, okay, you know, this is the problem, and so what are you going to do with that? That's the most important. Okay, I would say that when you conduct a research, you publish, okay, people know what, but what is the solution to that? Okay, so in this case, what we try to do is to build resilient in nursing student. Coming soon, we're going to do RCT on building resilient in nursing student. So resilient is the ability to become strong, healthy, and successful again. There's something bad happened, and ability to something to return to its original shape after it has been full stretch or pressed or bent. So this is the definition of the resilience. So what we try to do is to increase the self-efficacy in the student, and make them control themselves, so that they can be successful and have the coping strategy how to navigate their stress level. So to increase self-regulation, also the student can do a lot of things, like for example, learning relaxation technique, meditation, aromatherapy, and a lot more things that the student can do to reduce anxiety and also stress. Another strategy is that we have the module, we call it a resilient module, that we bought from the company that built a resilient module, and then we give it to the student, where they learn a lot of I believe 12 module how to become resilient, because the nursing student facing a lot of challenges. They need to build resilience in themselves. If not, they will leave the program, and then our attrition rate will be low. Another one is that we also recommended a stress management coping strategy, self-care, and also building social support network. Building social support network is very important, because when you feel very, very isolated, you don't have any network, and you feel very, very lonely. You feel very, very helpless. So this is very, very important for the student to have building their social support network. I would say especially for the international student, because I know the local one, they can go to their parent house, their family house, or their close friend house. But for the international student, the one that stay here, they cannot go back. That's where they really need to build the social support, because when they're facing any psychological impact, they need some help, especially to recover their mental health, or to make sure they are in the emotional stability. The other one that we also provided to our student is the counseling. And our student, I would say all our student need to take the crisis training, mental health crisis training, which is a must, not any option, because when they go to the clinical practice, I would say whether hospital, long-term care, or community placement, there always a situation where the student will deal with a patient that have some mental issue. So this is why we provided our student with a mental health crisis training. As if we look at the literature review, we know that resilience is something necessary for our nursing student, because when they have the resilience and the coping strategy in themselves, they can bounce back to the whatever the challenges that they're facing. Sorry. So based on this, based on this study and also literature review, we all know that all of us, whether we are in the institution, whether we are faculty member, or whether we are physician or nurses outside there, we need to support our student. We need to work as a team, and we really need cooperation from all interdisciplinary, because during COVID, we cannot work alone. So what are the nursing perspective when we look at the sustainable healthcare? So before we go to the sustainable healthcare, what we learned from this pandemic, okay? Because if we understand what we learned from the pandemic, then only we can plan the strategy how we're going to sustain the healthcare. Okay, what we learned from the during pandemic is that most hospitals are understaffing. So when you have not enough nurses, so the quality of care will be compromised, because if we look at the main core of nursing is about safety. Safety comes first. So when we have understaffed nurses, so the quality and the safety of the patient is going to be compromised. So this is what we learned. And because of that, many nurses have impact on physical and also psychological well-being. They're facing a lot of mental issue. They're facing a lot of hardship when they have to go to the hospital and work on sometimes 12 hours, sometimes here they make it mandatory. You have to work maybe 16 hours, not 12 hours, but 16 hours. And some of the nurses have to do double duty because they don't have enough staff. The second thing is that we learn is that most of the nurses, they don't have clear role or function, what they need to do. because at one point we know that we also not sure what kind of virus that we are dealing with. So they don't have any information. So they don't have any clarity about their role. What should I do? What can I do? How should I function? So there's no structure, there's no framework. I believe that we have the basic thing about control, infection control and everything, but we are not sure what we're dealing at one point. Another thing that we learn from this is that we are unprepared. Okay, the knowledge and competency, what kind of knowledge that we need to deal with the pandemic, and what competency that we need to deal with this. We also, I would say, unprepared for the anticipated increases in the demand of the service. We didn't see that is coming, that so many people need ventilator, so many people need to do testing. We are not ready for that. So this is what we call unprepared for the increased demand for the services. If you look at some hospital, they have I would say backlog for the surgery and other cases. For example, chemotherapy for cancer patient, they have to delay some surgery. There's so many things that they have to stop at one point because they want to deal with the COVID-19 patient. Another thing is that we also know that there's a skills shortage and also uneven distribution of the human resources. What I try to say here is that during pandemic, most nurses that are very skillful, especially nurses that train in to deal with the patient in the ICU, we need respiratory nurses. So we don't have that kind of luxury of nurses that have special skill at that moment, because they work with a group. They have respiratory therapy, they have the doctor, they have all the ICU nurses that dealing with the emergency and understand about the ventilator. So there's a lot of things that not general nurse that in medical or surgical can do at that time. Of course, I would say it's very, very challenging, but I do understand that some of these general nurses go to the ICU to help their colleague. Another one, we also learned that we run out of the supply. Not only medication, but also the equipment. Okay, we lack of some medication. We also lack of ventilator, mask, PPE equipment. There's so many. This is what we learned from during COVID-19. And we also learned that we not invest enough in nursing profession, especially to train nurse practitioner. Because during COVID-19, we learned that nurse practitioner is very, very important, because they can have their own clinic, they can treat their own patient, and these will reduce the number of patients going to the hospital. So we know that this is not adequate. So I think that the investment to educate nurses to become nurse practitioner is very, very important. Okay, to say that it's a post-COVID, I will not say that, because we're still dealing with COVID. I don't know, the sixth wave is coming. That's what I believe so. So from the nursing perspective, how we can sustain the healthcare during and also post-pandemic. Sustainable health system is about improve, maintain, and restore the health, minimize negative impact on the environment, and leveraging opportunities to restore and improve it, and to the benefit of the health and well-being of the current and also future generations. So this is all about what we can do to sustain the healthcare system. So, when we talk about sustainable healthcare, from the nursing perspective, I would say education and training needs is very, very important. If you look at the WHO Global Strategic Direction for the Nursing and Midwifery for 2021 and 2025, they say that we should focus on the strengthening the workforce in the nursing and midwifery in order to achieve a universal health coverage goal for the population. Because we are shortage of nurses, we have nurses that lack of some of the skill and competency. So we really need to focus how we're going to strengthen the workforce. If we're not strengthening the workforce, then we cannot sustain our healthcare system. So how are we going to do that? Okay. The education sector should prepare professional nurses who are capable of responding to the health need of the population. So we need to upgrade the clinical skill knowledge in the area pharmacology, psychology, diagnostic and treatment, and also in addition, we need to always giving them continuing education at the workplace and also in the faculty or in the university. We need to look at what current needs that nowadays the nurses need to study. So this is what we need to adjust our curriculum. Okay, what are our need now? What is most important? Are we going to look at the curriculum that we developed 20 years ago or 10 years ago? Maybe not, I would say, because there's a lot of new thing happen. So we need to look at that and provide the new curriculum for our student. We also need to do ongoing training, how to do the appropriate PPE and any new therapies outside there based on evidence-based evidence-based. So because when we're dealing with the COVID-19, we know the changes coming very fast. So we need to update them. What is the best? How to use? How to wear this? And what are the new therapy we learn outside there today? So it's very important to train our nurses with the new or the current based on the evidence-based practice. Another strategy to sustain our healthcare is that to invest in nursing education. Okay, I believe that in my place right now, what they do is the government giving us 2 point something million to increase the seat for the number of the nursing student. So they give us 2.1 million to increase our seat for the nursing student, because we believe that we need more nurses, we need to train more nurses. So the government try to invest in education so that we can produce more nurses. Another thing that we can do to sustain the healthcare is that role expanded by appropriate education. Nowadays, our nurses have different role. They can do most of the thing that the doctor can do by having appropriate education. So we also develop a new I would say, master in nurse practitioner, so that many nurses can open their own clinic and contribute their expertise to look at and treat the patient. Another thing that we can do is that we need to have remote services, which is telehealth and also video conference, where this new technology, I would not say new technology, maybe some, where we believe that very, very effective. When you see that many patients use telehealth and also video conference during pandemic, where they have a physician or nurse practitioner to deal with whatever that their disease, or they even prescribe medication to the patient during video conference and also telehealth. So the technology, to make sure that the technology can be accessed in the remote area, is very, very important. So I think we also need to train our nurses how to use telehealth and also video consultation, so that they can help our patient in the remote area. Another thing that we can do is that we need to develop the community support for rehabilitation and also mental health among COVID-19 during their recovery phase. So what we do is that we have the case manager, community nurse, and also case manager that dealing with the patient that in the state of recovery. So this is another way how we can sustain the healthcare, by having something outside then in the community, not in the hospital, because we try to limit the number of patients coming to the hospital. Okay, another thing is that's what we can do for our nurses. So when come to the university, what we need to do to sustain the healthcare system. So it's very, very important to develop the knowledge and confidence of the faculty to integrate global health and also sustainability of health care into the education of health professionals, from undergrad training and postdoctoral training, and also continuous clinical practice. This is very, very important. The university should provide the training and also the support of resources to the faculty member, so that they can integrate about the global health and how to maintain, how to sustain the healthcare system. Because the faculty need to have that knowledge and confidence first before they can teach their student. So that's a very, very important for university to provide and develop the opportunity for faculty member to train and also have the skill to teach the nurses outside there, and also our nursing student. Another thing that we can do is that another requirement here and also in US, we can see the latest requirement is that during accreditation, we are asking to integrate sustainability of health professional education in our new graduate curriculum. So this is very, very important. It is not only because of the COVID, but it's something to do with the global health. Also, one of the new requirements that we now need to provide the evidence to the accreditation body is that we integrate the sustainability of health professional education. So this is something quite new that most of the university or college need to provide the evidence. Okay. We also encourage the student to collaborate with the faculty to take an active role in their education, where they can come out with design participation and also any material during the class or any clinical session. So work together, learn from the student, and also we always encourage to learn from other institutions. So we always need to have a good collaboration from other universities so that we can learn from them. Okay, what most important to do during pandemic? How they do it? What we can do to overcome the challenges. So sometimes we not only learn from other university, we also learn from our student itself. When they go to the clinical, we need to learned from them what challenges they're facing and how they overcome. It's something that not only, oh, you have to teach the student, no, but sometimes you also need to listen to the student. Okay, another strategy that we need to do to sustain the healthcare system is that institutional leader must urgently support our student faculty education system by using framework for change to ensure sustainable healthcare. So when the student is outside there, we need a lot of support from the institutional. We need to have a great leader or strong leader. Okay, what we need to do to make sure that the student graduate on time, our student pass their national exam and everything. So this is all the support. What kind of support the faculty need? What kind of support the student need during COVID-19? For example, I remember during COVID-19, the student cannot work because during the normal time, they can do their part-time to support their rent, to support their living. So when come to the pandemic, they cannot do that. So the institution even offer them some I would say funding to help them with the rent and also their living. So this is very, very important when come to the pandemic. We also know that during the COVID-19, we need for the professor or faculty member, we need to have a lot of training. Training how to navigate the education through the online. I remember for, I would say, how many weeks we are required to learn about online delivery of the program. I was like, every single day there will be something workshop on how to engage with the student, how to do this, how to do the test, how to navigate the question, how to do the poll. There's so many things that we need to learn, because we need to learn all this so that we can deliver a good quality education, and then based on that the student can provide a good quality care, and then we can sustain our healthcare system. As I mentioned before, our curriculum that we offer to our students must be based on the need of the people and also global health. So we cannot use our old curriculum. We always need to do some modification. We need to introduce new subject that really related to the needs of the people and also global health, which is very, very important in education. So another way is that we need to use a combination of system thinking, change management, quality improvement, and also approach based on the framework or model to look at the strength and make it that we bring the vision to the action. Many places have vision, mission, but when come to the action, always we will see a lot of lacking in that. But this is the time when we need to sit down, bring our vision and mission into actions so that we can sustain our healthcare system. Okay, another thing is that we need to effectively facilitate sustainable change through understanding how people and system work and interact with each other to create the change. So this is very, very important. We need to look at it. We need to understand why this thing happened, how vaccination can reduce the number of COVID-19? What are the long-term care of vaccination? What happened to in 2 years or 3 years? We are not sure about that. So we need to really look at the changes that happen today and try to understand how people and the system work together. So based on that, we can create the change, and we also can change our policy, or we can introduce new policy based on the research that maybe shows something is very, very important. So this is how I would say that from the nursing perspective, how we can support or sustain the healthcare system, which is very important. We need to educate and training our nurses. They need the skill, they need the knowledge, because they are dealing with something unknown and something that continuous, that really impact their physical and psychological well-being. Okay, the conclusion for my talk today is that COVID-19 has rapid change and learning and change the learning and working condition of nursing student and also nurses outside there. This lead to an increase in the stress level and experience of traumatic events. Coping strategy are very important to address the impact of COVID-19 pandemic among nursing students. So one of the strategy is by building resilient to provide student with the approach to address any challenges that they have right now. And it's very, very important to integrate of education and training that focus on, I would say, how to sustain our healthcare system. We always heard some of the place that their healthcare system nearly collapsed because of the pandemic. So we don't want that to happen in our place. So that this is very, very important for us to make sure we integrate education and the training needs to face the challenges. Another thing that we need to do is that we really need to invest in our nursing education to meet existing health needs demand, and also to prepare for unknown global disease, because we're not sure in 2 years or next year or next 5 years what are the things going to happen. So this is very, very important. We need to make sure our nurses is ready to face any challenging factor outside there. With that, I would say thank you so much. That's what I have for today.
Thank you. Thank you for the wonderful talk, Prof. Nora. Stress was one of the biggest issue during the pandemic, and it still is. And it's great to see all the efforts you made to help the students with the stress management. Thank you for sharing it with us. So I would like to invite Prof. Rosli to present Prof. Nora with a certificate as a token of appreciation.
Assalamualaikum, Prof. Nora. Thank you very much for excellent presentation about stress among nursing students. And I think this, I'm also basically very interested in the stress study, for my PhD student, my master student. So I found this study very apt to be used not only in Canada but also Malaysia. So congratulations on a very excellent paper. we look forward to have you again with us.
Thank you so much.
And this is just token of appreciation.
Thank you.
very
Thank
much.
you very much. Thank you for having me.
Yeah. Thank you, Prof. Nora. Thank you, Prof. Rosli. Thank you very much. So without further ado, I would like to invite our final speaker for today, Dr. Garrett Sim Mao Shin. He is a senior lecturer at University of Malaya in the Department of Pharmaceutical Life Sciences. Dr. Garrett obtained his PhD degree in medical science from University of Malaya and was a former SLAI fellow under the academic training scheme from the Ministry of Education, Malaysia. Welcome, Doctor.
Hi. Thanks, Dr. Menaga. Can you hear me? Okay. Hi, good morning, everyone. I'm Dr. Garrett from Faculty of Pharmacy, University of Malaya. First, I would like to thank the symposium committee for the invitations, and it gives me an opportunity to share with you the topic of pharmacogenomics of drug abuse and dependence. And also, I will share with you on how the genetics information can be applied for prevention and personalized medicines. Okay, maybe some of you may know who is this person. His name is Hippocrates. Okay, he is known as a founder of medicines, and he was the greatest physician at that times. In 2,500 years ago, he was already aware that not all the substances have the same effects on the patients. So with the same drugs, different patients may show a different efficacy or drugs effects. But why? Okay, this question becomes a fundamental for many researchers to study the associations between genetic factors and the drugs responses. So you can see from these figures, for example, in a group of patients, some patients shows a toxicity to a drugs, but some patients may not. Also, some drugs may be more effective for certain patients or group of patients or any populations, but some may not be efficient. Therefore, in a group of patients, although they have the same disease, we cannot use the same drugs or same dose or same treatment methods for those. In the medical line, definitely the toxicity and efficacy of drugs are very important to give the right and the better treatments. So as I mentioned just now, different patients with the different symptoms, same findings and same disease. If we give the same drugs or same dose of the medicines, you may get a different outcomes. Some are efficient, some are not efficient, and even some will show harmful effects. But why do drugs responses vary among the patients? Yes, it can be by chance, but chance is difficult to predict. Among these factors, genetic factor can be the most prominent because genetics can be linked to other factors. For example, like ethnicities, age, diseases, drug interactions, and many more. So from the genetic factors, drugs variations or genetic polymorphisms are the most commonly are most common among the individual. So as you know, DNA regulates all humans' activities. Therefore, any tiny changes in DNA sequence may change your body's activities. So the genetic variation or polymorphisms can be very useful as a biomarkers for the future preventions and the treatments. Okay, there are many kinds of genetics variations may play important roles in the pharmacogenomics. For example, single nucleotide polymorphisms, SMP. SMP are the most commonly occurring genetics variations. And the next one is the insertion deletions and various number tandem repeats, VNTR. VNTR is a sequence repeated in tandems in a variable's copy numbers. So the repeat unit can go up to hundreds units. So for genetic variations, normally we can call them polymorphism or variations when it is more than 1% in the populations. It's different with the mutations. Therefore, from the genotyping data from the patients, we may able to identify which patients, which groups of patients, or which populations respond well to the particular drugs. So by this method, we can prevent the side effects or adverse effects of the drugs that can minimize. We can minimize the trial and error, which is commonly applied in the current practice. So it takes a long time to discover drugs and so on. So because we cannot assume that one size can fix all. Besides, it also can reduce the medication cost because we do not need to give the drugs to the patient if we have if we know that the drug is not effective or even bad to the patients. So the manufacturer can save costs and the hospital can save costs, and also the patient also can save a lot of costs. Due to the individual variations, study shows that 20 to 40% of the patients benefit from an approved drugs, but about 70 to 80% of drugs candidates fail in the clinical trial. So many of these drugs are removed from the markets because of the adverse drug effects. Therefore, we can try to use the information in the DNA sequence to identify and predict the reaction of the drugs. So this is why the field of pharmacogenetics or pharmacogenomics is quite commonly nowadays. By using these pharmacogenomics or pharmacogenetics techniques, we can personalize drugs or faster the clinical trials. So, but the most important is we able to minimize the drug side effects of the treatments. This is what the patients don't want. So pharmacogenomics mainly aims to convert the conventional treatment strategy to personalized medicines. Before implementing personalized medicine, definitely we must understand the human genomes and the genes function as well. And so by this way, we try to, before we implement this, we have to find a way to simplify the methods to get genetic profiles or informations related to certain disease. As you know, different individual or different group of peoples or different populations, they have different genetics compositions. Therefore, we also can know their genetics informations and their patterns. And finally, we're able to select the most effective drugs for that patients. So by this way, we no need we no need to have a long time to for try and errors. It is able to prevent and toxicity and minimize the adverse effect of the drugs. Okay, we know that genetic factor cannot solely affect the drug responses. Others intrinsic or extrinsic factors like age. Okay, for example, the young people normally has a higher drugs metabolism rate if compared to elders. Gender, like certain diseases are more susceptible to female, like the breast cancer, and however, for the males, it has a higher risk of prostate cancer. Ethnicities, because different ethnicity may have different genetics pool, genetics composition as well, so they may have effects as well. And also diseases, diets, and the culture, all these can affect the drug response as well. But why this? Why can this be affected? Definitely, it's due to the different level and patterns of the gene expressions and affect the protein expressions. So it affect the phenotypes. There are some examples of common drugs. It shows how many percent of the patients know effective with the drugs, and some are even harmful. For example, SSRIs. Okay, SSRI are the normally used as a first-line drugs for depressions. But the SSRI, like the fluoxetines, can cause insomnia, tremors, and decrease the sex desired. Others, like the sertralines, may cause a seizure and memory problems. Citalopram may cause QT prolongations. And so even for the COVID vaccine, I think everyone knows that COVID vaccines can give a lot of side effects as well, adverse effects. Some people, they may have serious adverse effects, some people may not. And some people may have effective to the vaccines, but some people may not. And we also found that some people's effective to Pfizer, and some people effective to Sinovac. So all these things we can relate it to, we can apply or integrate into the pharmacogenomics and try to minimize the adverse effects. But definitely a lot of challenges we have to be facing, because definitely the cost is very expensive. So no drugs can be perfect for all individuals. Some people may not respond good to fluoxetines, and some may have a very good response to the fluoxetines. Therefore, the personalized medicine is essential to increase the drug efficacy and minimize the adverse effect of the drugs. Here are some example cases that shows different groups or different population with different drug response and treatment outcomes. For example, you can see that a study shows that women respond better to narcotics painkiller than the non-narcotic drugs. Asians has a higher level of alcohol dehydrogenase enzymes, which the alcohol in the body can be metabolized faster. And also, you can see that a study, this is our study as well, actually, from our groups. Okay, we found that 67% of the methadone users have sexual dysfunctions, which may induce the drugs addicts to quit the drug cessation programs because the sexual dysfunctions already affect the quality of their life. And this study found that 21% of the patients required those changes, and 79% were safety-related dose reductions. The drug dosage also have to be considered actually, especially for those special populations like renal, hepatic impairments, pregnancy, and so on. Therefore, we need to adjust the dose or change to another drugs if we found that the drug is not suitable for the patients. Besides that, the drug manufacturer also should have dosing recommendations for different group of people to avoid the adverse effects. Okay, when discussing the adverse drugs effects, illegal drugs like the heroin, cocaine, methamphetamines must be at the tops. One of the most prominent undesirable side effects is addictions. I think everyone know about this. Therefore, this addiction drugs is highly abused. But are people predisposed to addictions, or they are addicted because of their surroundings? Definitely, genetic cannot determine whether a person will be a drug addict or not. Other factors like environmental factors are playing a very important role as well. Although a person has addictions associated genetics polymorphisms, it doesn't mean that the person must be addicted to the drugs, as long as he has no chance to expose to the drugs. Some people may be curious that what is the relationship between genetics and drug addictions? People may think that anyone who uses drugs should be addicted. Do you agree? Actually, some studies found that not everyone will be addicted to drugs, even those they are exposed to it. Some people may not able to enjoy the feeling of the drug, enjoy the feeling given by the drugs, and some people may not able to accept the side effects of the drugs. So it's the same as some people they like to eat sweet food, and some people they don't like, or some people they like to drink coffee, and some people they don't like because maybe coffee can give them dizziness and so on. Okay, so for those who cannot enjoy it, they may easily quit and discontinue. Otherwise, like these bubbles, they are vulnerable and easily break the protections. So, why this can happen? Definitely is explained by our genetics. Pharmacogenomics is the study on how variation in the human genomes affect the drug response. The application of the pharmacogenomics study will be able to identify the important genes or polymorphisms which are associated to drugs addictions. And the pharmacogenomics is used to predict the individual's risk of drugs abuse vulnerabilities, drug response, and the response of the treatments. Furthermore, studies also shows that the predispositions to substance dependency and the vulnerabilities to relapse after treatments are genetically related. So they reported that at least half of a patient's susceptibility to drug addiction can be linked to genetic factors. But remember that someone with addictions associated genetic makeups doesn't mean they have to be the drug addicts, because the genetic makeup just let you know the risk of getting addicted to drugs and how difficult a person to quit. So this is the reasons why we want to study the pharmacogenetics or pharmacogenomics of drugs addictions. So from this figure, as you know, every human has a different genetic compositions. Okay, no one's perfect. Okay, so with the same drugs, different DNA composition may lead to different drug response. Okay, so no animation here. Okay, never mind. Okay, so actually the animation I want to show here is it shows the in a group of methamphetamine user. Okay, not everyone's experience similarly. Some may feel present, some may feel unpresent. So from a NIDA's supported twins study, it shows that there is a heritable component to drugs addictions. Therefore, addiction is possible to be inherited. Another study found that 15 chromosomal loss sites are associated with substance abuse vulnerabilities. So from genetics profiles or genotypes, it can be used to improve the management of the vulnerable individual and reduce the cost of addictions preventions and the treatments. Okay, this slide shows showing the genes that associated with the addictive diseases. For example, they are the receptor, transporter, and some related to metabolizing enzymes and so on. All these can be they found that is highly associated with addictions or addictive symptoms. There are some of the substance addictions related genes. For example, the opioid receptor and the serotonin receptor genes are associated with substance abuse and addiction susceptibility. Well, for PRs1 and 2 and the neuropeptide Y genes are associated with alcohol use. This is because some polymorphism may affect the function of a genes, For example, some polymorphism may partially or completely inhibit the function of a gene, and some may induce gene expressions, and some may produce different products, and so on. Sorry, the slides hang. Okay. So this is one of the studies conducted by in Sweden. Okay, so they determined that the association between functional polymorphisms in the mute opiate receptor genes and the opiate addictions. So they found that the G area is at higher risk of getting of being addicted to opiates among the Swedes. Besides opiate addiction, they also found tested for the alcoholisms. They found that this genetic polymorphism is significantly associated with the alcohol dependence. It showed the risk for those who carry the G areas, either homozygous or homozygous G areas, is 11%. Okay. Furthermore, okay. So for this study reported that reported a drugs called naltrexone. Okay, naltrexone is a drug with a high potential to treat heroin addictions. So this naltrexone would be more effective. They found that these naltrexones would be more effective for treating heroin addictions if the patient have a genotype AG or GG. So it means that the patient with the G areas are more suitable to use naltrexone as a treatment. So it can be used instead of the methadone, because nowadays in our country we still using the methadone as a treatment. But methadone has, although they are the best drugs currently used, but it has a very high side effect as well. It can cause a sexual dysfunction, can cause a QT prolongation, and so on. A lot of things. So if let's say we know that naltrexone can be used, we may able to replace the methadones with the methadones, and then we can give the patients according to their genotypes. While looking at our studies, we also found some interesting findings. For example, we found that the BDNF RS6265 functional polymorphisms were significantly associated with methamphetamine dependence and methamphetamine-induced psychosis in the Malaysian Chinese populations. This BDNF is a growth factor that promotes the survival of neurons by playing a role in the growth, maturations, and maintenance. The next one is the FAH. This functional polymorphisms is we found that it's significantly associated with methamphetamine dependence and also the methamphetamine-induced mania in the Malay populations. So this FAH enzymes is responsible for the hydrolysis of several primary and secondary fatty acid amides. And the next one is DTNBP1 genes. This polymorphism is associated to with methamphetamine-induced panic disorder. Although in the Malays and Kadazan Dusuns, although we can't see any significant association with drug addiction, but it shows is highly associated with the drugs-induced panic disorder. Furthermore, we also investigate several genes, genetics polymorphism in the SOD2 genes. The SOD2 genes encodes antioxidants enzymes, which is important constitutes in the apoptotics, signalings, and the oxidative stress. We found that these are the two polymorphisms, RS4880 and RS284298, were associated with methamphetamine dependence in Chinese and Kadazan Dusun populations. But interestingly, this RS4880 functional polymorphism was highly associated with methamphetamine-induced suicidal ideations in the Kadazan Dusun populations. So it means that among the Kadazan Dusun's drug addicts, most of them has a higher risk to get to have the suicidal ideations. So okay, so we also study the effects of the combinations of four SMP in the SOD2 genes to analyze as a haplotypes. This combination was significantly associated with the methamphetamine dependence in the methamphetamines, Chinese and Kadazan Dusun populations. Normally, one SNP is we can't determine a person's according to one SNPs. We have to do a haplotype analysis with a group of SNP to see the combinations effects. So in conclusions, pharmacogenomics data will be very useful to help us to understand the variability in the drug response from person to persons. Pharmacogenomics as a cornerstone of personalized medicines. Therefore, we should embrace the challenges ahead of us and use the available tools to pioneer the applications of pharmacogenomics guided treatments. And even it can be integrated with AI's concept in the future. It will be very useful. And moving forward, the future treatments should be safer, more effective, and cost effective. That's why the pharmacogenomics always emphasize that the right drugs for a right patients at the right dose. Who knows, in the future, you just need to bring your genetics informations to the pharmacy and get a suitable drugs or more effective drugs. So it's more convenient. So no need to worry about the side effect in the future. So before I stop my talks, I would like to share a bit about my labs. This is my labs. Its name's Pharmacogenomics and Precision Medicines Laboratory. Although our lab is not that big, but it has a complex facilities for pharmacogenomic studies. So you can see this photo is our pharmacy building, so which consists of 4-story. Actually, I have shown another picture that is our team member, but it's no animation here. So we have our team members to study the addictions behavior, addiction genetics, and actually we went to drugs rehabilitation center in Sabah last year for sample collections. And our pharmacogenomics team member also actively collaborates with many other researchers, scientists, and clinicians from various disciplines in all these ongoing projects. So there are some of our research collaborators. We have signed a MOU with some of them on certain projects. Besides, I also have a research project with MAHSA University. So hopefully more research collaboration is coming soon. Actually, we also provide some laboratory services like the genotyping and the gene expression services. So people can send their samples to us to do the analysis, or they can send their researcher or students here to use our facility. But definitely will be certain charges. So this slide shows we have some other equipments, for example, like the HPLC, LCQ-TOF, and GPC, and FTIR, and so on. So it's can be used for the research. Besides, I also would like to take this opportunity to promote our coming symposiums named Impress. Okay, we are very honored to have Professor Griggs, a Nobel laureate of medicines, to give a talk during the symposiums. So it's fully online. So welcome everyone to join. So the date is 8 to 9 December this year. So for more detail, you can visit our faculty website. Okay, and that's all from me. Thank you for the invitations.
Thank you, Dr. Garrett. Personalized medicine sounds very interesting. I think it would be great for us to bring our DNA to pharmacies and get our personalized medicine. So you also shared with us a lot of SNPs in many important enzymes in human. Thank you so much. So I think this is definitely one of the important field to be explored further in future, probably in the field of research, cancer-related therapies. So thank you once again. And now I would like to invite Prof. Rosli to present Dr. Garrett with a certificate as a token of appreciation.
Okay, thank you for the invitation.
Thank you, Dr. Gareth. Thank you very much. Very interesting talk, Dr. Gareth. I attended one on precision medicine, I think about a year ago in UKM, and I think this is a way to go. I mean, the future will be precision personalized medicine, I think. The only thing is that I was worried is the cost at the end. How much will the patient has to be charged, with all these DNA studies and so on that need to be done, genetic studies.
Yeah, this is
But otherwise, I think that's the way to go because it's very, very personalized.
I think the objective is very clear. We want to move forward to personalized medicines. But as you said, the biggest challenges is the cost. We have to find a way to reduce the cost. If not, we can't commonly apply this personal medicines to the patients.
Thank you, Dr. Gareth. Thank you very much. And hopefully we can call you again to MAHSA University. And we look forward to have another round of discourse with you regarding precision medicine. Thank you very much.
Sure, no problems. Yeah, look forward for that.
Thank you, Prof. Rosli. Thank you, Dr. Garrett. Thank you very much. Distinguished guests, ladies and gentlemen, we have reached to the end of the MAHSA International Medical Technology Conference 2022 opening ceremony. On behalf of the organizing committee, I wish to convey our heartfelt thanks to all our guests online and conference participants for joining us this morning. We will now have a lunch break and we will be back for the parallel session at the dedicated Google Meet link. The link is provided in the program schedule. We will end the session with MAHSA's song.
Menggapai takkan impian. Kita sang juara, penerang